Hi, I'm Dr. Yeshwant Mane, Director, Atharva Infertility Centre, Nasik. Today we'll be discussing what is ICSI. ICSI is defined as Intracytoplasmic Sperm Injection. ICSI is basically a micromanipulation technique in which a healthy sperm is selected and is directly injected into the ooplasm of the egg. Of the different micromanipulation techniques like partial zonal dissection, subzonal injection, and intracytoplasmic sperm injection, ICSI has gained worldwide acceptance. In ICSI, the healthiest looking sperm is selected by the embryologist, and that sperm is, with the help of a micromanipulator, the egg is held on one side, stabilized, and it is taken care that the polar body is either at 12 o'clock or 6 o'clock position. The egg is fixed and a healthier sperm is selected, and it is directly injected into the cytoplasm of the egg. And this is used for fertilization of the egg. We'll be discussing what is the difference between IVF and ICSI. Both these methods are used for fertilization of the egg. When IVF was started in the year 1978, scientists used a conventional method to fertilize the egg, in which a healthy egg is taken in a petri dish and 50,000 sperms are deposited around the egg, and they wait for spontaneous or natural fertilization. In IVF, the healthiest sperm penetrates into the egg and forms a zygote. So in IVF, there is natural selection of the sperm. As compared to ICSI, in ICSI, a single sperm, a healthiest looking sperm is selected, and that sperm is injected directly into the egg. Now, what are the steps for preparation of ICSI? The husband's semen sample is taken, and the sample is prepared either by swim-up method or by density gradient. In the lab, the embryologist prepares the ICSI dish, and after preparation of the ICSI dish, the sperms are deposited in a media or chemical called as PVP. PVP is defined as polyvinyl pyrrolate, in which the motility of the sperms becomes less. So it becomes easy for the embryologist to identify the sperm which is to be selected for ICSI. He crushes the tail of the sperm, immobilizes it, and it aspirates the sperm into the injecting pipette. Now this healthy sperm is selected and is directly brought into the injection droplet where the eggs are already loaded, and the sperm is injected into the egg. Now, what are the indications for ICSI? ICSI has revolutionized the treatment for male factor infertility. It is a boon in males where the sperm count is very less, or in cases of males where the sperm count is absolutely zero. In males where the sperm count is absolutely zero, or we call it as obstructive azoospermia, the sperms are directly aspirated from the epididymis or from the testes of the male, and these sperms are selected for ICSI. So, as compared to conventional IVF, where you require at least 50,000 sperms for an egg to fertilize, in ICSI, even if the sperm count is less than million, or even if the semen count contains very few sperms, or if the testicular or the epididymal aspirate contains very few sperms, with these few sperms, the husband can have his own genetic child. So this is the greatest advantage of ICSI, which is not possible with conventional IVF. So I would like to repeat that ICSI has really revolutionized the treatment for male factor infertility. Also, ICSI can also be used in cases where the male is scheduled to undergo chemotherapy or surgery prior to testicular cancer, where the frozen sperms are used, and those sperms are used to fertilize the eggs so that he can have his own genetic child. Now comes a very valid question: which is a better way of fertilizing an egg, a conventional IVF technique or ICSI? In conventional IVF, the nature allows the natural selection of the healthiest sperm to fertilize, whereas in ICSI, the embryologist selects the morphologically normal appearing sperms. But The disadvantage with conventional IVF is the total fertilization rate of egg is slightly less as compared to ICSI. So we at Atharva Infertility Centre, we have been practicing ICSI for all since so many years. And the advantage with ICSI is we are very sure that the egg has the maximum fertility potential, and the biggest drawback of conventional IVF is like total fertilization failure. If it occurs, this thing doesn't happen with ICSI. So we have followed the new protocol for ICSI for all since last 10 years. Now the next point comes, what happens after ICSI? When the sperm is injected directly into the ooplasm of the oocyte, it undergoes the further steps of maturation and development. So at 16 to 18 hours, when we observe the oocyte, you usually find the egg to be fertilized, and we find it at 2PN stage. 2PN stage means 2 pronuclear stage. One pronuclear is the male and another is the female. ICSI is associated with some inherent risk, theoretically speaking, because some gene disorders, if the sperm selected is an intrinsically abnormal or it carries some genetic defect, it cannot be identified with naked eyes. So there is a theoretical possibility that chances of congenital malformation in the newborn are slightly less as compared to conventional IVF.